Right. So for those of you who joined late, so we are starting with Apixaban discussion. We just had a short practice scenario. This is the little change that I have brought from, I think, April onwards. We practice and then we discuss. Okay. So today's topic is Apixaban discussion. Like I said in the beginning, it won't be the exact same scenario which you will get in the exam, but the discussion that we have here, it will be quite relevant for what points you must be discussing in the exam. Okay. Today's session is about clinical scenario, history taking, examination, management, any questions you have regarding this particular scenario, and that's about it. So I'll try to finish as fast as I can because I do not want to take a lot of your time. It's just one topic, right? Okay, let's begin. So the scenario is you are a junior level doctor in the medicine department. Lisa Claire is a 35-year-old who was diagnosed with deep venous thrombosis last week. She was admitted, managed, and is now ready to be discharged. As a part of her discharge medications, it has been decided to start her on Apixaban. Please talk to this patient regarding Apixaban prescription. Okay. You may or may not have a prescription kept inside in the cubicle. Why? Because we want to limit contamination as much as possible. Okay, so please do not panic if you do not see anything. If you see something, well and good, pick it up, write it down. All right. Moving on. What is relevant in history taking? As I always say, start with P1, P2, and P3 format. Just to recap, what is P1, P2, and P3? P1 is history of presenting illness. P2 is past medical history, past surgical history, any drug history, sexual history, and in women, obstetric and menstrual history. Okay, all of this comes under P2. P3 is more of personal history and lifestyle, psychosocial basically. Okay, for this particular scenario, I would prefer you keep the P1 very brief. Okay, keep it very brief. What do I mean when I say keep it very brief? I mean do not exceed more than 3 to 4 questions. Okay, there's no need for you to go into an elaborate detail over here. Keep it very brief. Why? Because patient is still in the medicine department, right? If this patient was someone who was coming back to the GP clinic for a review, then it's justified if you take a very long P1. However, in this scenario, please keep it brief. Okay. What are the questions you will ask in P1? So, how are you doing today? Are you comfortable to talk to me? Do you have any pain? Which leg was it? Okay, so on which leg was she diagnosed with DVT? Was it one or was it both of them? Please remember to ask this question. Very, very important. If you just ask, how are you doing? How is your pain? How is your warmth? How is your swelling? It could be anywhere in the body. Even if she says leg, please make sure to ask which one, the right one or the left one, because that demonstrates active listening. Okay, moving on. Like I said, in P1, quickly recap the events. How is she feeling now? And the other question to ask is, which leg is it, or is it both the legs? Okay. Now, in P2, this is very important in this scenario. You cannot cut short things in P2. Okay, you have to take a little bit of an elaborate history over here. Why? Because you would like to know what is the cause of this DVT. What can be some causes of DVT? I'll look at the chat box for the answers. Yes, what are the things you would want to rule out in this patient? What sort of conditions? OCP use, very good, okay. Yes, hormone replacement therapy, very good, all right. Cancer, okay, agreed, okay. One more important condition you want to rule out. Just one more. Immobilization, okay, agreed, but that's not the one I'm looking for. Very, very important, this one. Rhythm abnormalities, irregular heartbeat, irregular rhythm. Yes, very good. Atrial fibrillation, very good. Okay, this is the one I'm looking for. Please, in the exam, at least have 4 causes in your mind. And when you take a P2, your history should cover these 4 points. So you want to find out the cause for this DVT. So she's already telling you that I took a long flight. So if she says one sentence, I took a long flight, please do ask from which country and how long was the journey. Okay, how many hours were involved. So please do ask that. Whatever the simulator tells you, whatever the patient tells you, your next question would be follow up of the place where they stopped. Okay, so if I say, oh, I was told that my DVT is because of a long flight, your next question will be, so could you just tell me a few details about it? So where were you traveling from? How long was your flight? Okay, please ask this. It's very important. Now, apart from that, any other medical conditions? What are you looking for? Any heart disease? Any diabetes? Have you ever been diagnosed with any bleeding or blood disorders? Okay. Did you have any surgeries done recently or in the past? If the answer to any of these questions is yes, please elaborate. How will you elaborate? What was the surgery? When were you discharged? Right? What was the treatment given? If this patient has some long-term medical conditions, how is it managed? What is the treatment being given? Are you regular with the treatment? So you have to elaborate. Whatever history you get positive, please do elaborate. Okay? Apart from that, what else is important? It is important to ask, do you have any problems or any conditions which you were diagnosed with relating to your liver or your kidney? This is also really important. Okay, patients can be diabetics with renal involvement, right? So you do want to keep an eye on that, because if you are going to talk about kidney function test monitoring, then please do ask in the history, why are you going to do that? You need to justify that, because normally we do not do any tests for Apixaban, right? We do not monitor the patient in any way unless and until there is something in the history that warrants us to monitor them regularly with the kidney function test. So please make sure that you ask in the history so that you are able to explain it in the management in a much better way. Because if you do not correlate both of them, then you might lose scores. Okay, so please make sure that you remember that point. Now, moving on to lifestyle. So, like I said, spend some time talking about the drug history. Okay, even though it's a part of P2, I have written it here as P3 because of the mnemonic. But anyway, if the patient is on any medications, the current medications, and if she has been taking any other medications. Use of contraception. Okay, this is also really important. How long did you take them? Are you still taking them? Questions like this is very important. Now, depending on what she tells you regarding the medications, you also need to find out if she has experienced any adverse reactions to any medications. Okay, this question is very, very important. Even if you do not follow all of the components of your mnemonics in the exam, it's okay. But remember to ask these specific points that I'm asking you, because that makes your history quite focused, quite short. You will finish your history in 3.5 to 4 minutes, and you will have a lot of time to talk about management. Here you need to spend a lot of time talking about management, okay? Because this is a scenario where you're being tested for your knowledge about medicine prescription and how you are going to talk about it. Okay, your interpersonal skills are what are being tested here. So please make sure that you have a very concise and very focused history. Okay, these are some important points which I'm talking about. I am elaborating these points here because I really, really want you to keep the history short and concise. Okay. Apart from that, what else you need to ask is, has she ever taken any other medications, any other supplements, or has she ever brought online purchased medications? Now, why is this point important? Because if you go onto the GMC UK website, you can see there is a prescribing information booklet. Click on that. These are the questions which you must not miss out when you are talking about these medications, especially blood thinners and blood clot preventing medications. Okay, so these questions are important. That's why I said keep your history concise, and apart from that, please do ask about this information too. Okay, now you do want to ask this patient about their habits. You want to know if they are smoking, if they are drinking, and if they are using any illicit drugs. Okay, before you ask about these questions, please make sure that you signpost. Signposting is very, very important. If you do not say that, I don't think anybody would be interested to talk about their habits if you don't signpost. Okay, it is a sensitive topic. Not everybody would be comfortable to disclose to each and every doctor that they have been smoking, they have been drinking, or they have been using some illicit drugs. Okay, so always signpost. You should say, is it okay if we have a little chat about your habits? And they say, okay, yes, doctor, all right. So, so could you tell me, do you smoke? No, I don't smoke. Do you drink alcohol? Yes, I do. Maybe occasionally on the weekends. All right. And how about some illicit drugs? Do you use them? Well, if you establish your rapport and then ask these questions, it makes sense, because if you do not signpost and straight away go to that, it looks very insensitive. So my advice is always signpost before asking about smoking, alcohol, and use of recreational drugs. Okay. This is important. Why? Because it can interfere with the medicine that you are prescribing the patient. Okay. So always make sure you signpost and ask for these habits. Okay. Now, moving on. Examination. So is examination relevant in this scenario? Do you think it's relevant? Do you want to examine this patient? Is there anything that this patient said in the history that warrants an examination? She is in the medicine department, first thing. Second thing, what did she tell you? She said, I'm comfortable, doctor. I'm comfortable. So throughout the simulation, she said, I'm comfortable. So if when someone is comfortable, no active acute complaints, would you like to go ahead and examine them? Yes, I'm waiting for an answer. Would you like to examine them for discharge? Okay. You will still go ahead. Okay. Right. Okay. So for the people who have said no and for the people who have said yes, remember that when you are going to examine the patient, always give a reason why you would like to examine them. Okay. So you can say, okay, because you are going home, that's why I would like to examine you just to make sure I'm not missing out on anything. And to the person and to the people who are saying, no, I don't want to examine this patient, you can say, okay, right now, from what you have told me, there is nothing which really warrants an examination. So I would leave it for the end of the discussion. Okay. Just leave it for the end of the discussion. That's a much better thing to do. Why? Because you have to focus on talking about Apixaban. That is really, really important. Okay. Now, coming on to talking about the medication. Okay, so here comes the part where you need at least 4 minutes to talk about this medication. Okay, at least 4 minutes you need. Why? Because this is a medication which is a controlled medication, right? It is a medication given only by prescription. So do spend some time talking about it. Okay. What are the things you need to tell this patient? So what is Apixaban? Basically, it's a medication that prevents blood from clotting too quickly. Okay. Why are we giving you this medication? Because we need to keep your blood flowing as thin as water. That's why. Okay. From what you have told us and what you were diagnosed with a condition called DVT, which means the blood has a capacity to clot quicker in your case. That's why we are putting you on this medication, so that we are able to prevent your blood from clotting quickly. Okay, this is what I mean. So I've given you the elaborate explanation. You can cut short this in the exam. Please often check your patient's understanding. Are you following me, Claire or Miss Claire? Are you following me? And she says, yes, yes, I am. Why is it important to maintain a two-way conversation? If your simulator or your patient understands at least two sentences of what you are trying to convey them, you have done your job. But if you go in there and you feel pressurized that you have to finish all the points that I have given you or someone else has given you, and you do not check patient understanding, and you do not maintain a two-way conversation, the chances are very remote to be successful. Okay? Please try to avoid doing that. Even if you have just said two sentences and your time was up, it is still okay. But just make sure that the two sentences that you said, the person in front of you or the person listening to you has understood what you are trying to convey. This is really, really important. I cannot stress how much important this is. Okay, please remember to do that. Now, what is the benefit of this medication over warfarin? The benefit of this medication over warfarin is that you do not need regular blood tests. It's a safer, much safer medication in comparison to warfarin. That's the reason why we have chosen this medication. Now, please do ask your simulator or your patient, have you understood what I have been trying to tell you? Is there something you would want me to repeat? Once again, two-way conversation, very, very important. Now, how many times a day or how do you need to take this pill? So basically, you need to take this medication or this pill twice a day, once in the morning, once in the evening. You can take it with food or without food. It's completely okay. All right. If you forget to take this tablet, would you like me to tell you what are you supposed to do? Ask them. Why? Because you have spoken at length about something and now you want to know if your patient is listening to you or not. So when you ask this question and they say, yes, yes, doctor, I had that concern in mind. What do I do if I forget to take my medication? Well, yes, we have the solution for you. What you would do is, as soon as you remember, please do take the medication. However, do not take two tablets together or two doses together. Okay, there should be a spacing of at least 6 to 8 hours between the first dose and the second dose. Just say this. You can maintain a diary. If in case you have missed any dosage or any medication, please do note it down. And when you go for the review to the GP clinic or to your GP, please do make sure to show it to them. Okay, we don't know whether this patient is coming back to us or this patient can review with the GP. Mostly they can review with the GP unless and until there is something which warrants our attention, they will come back to us. That is, we are in the medicine department. Always remember which department you are located in and what are you being asked to do. This question tells you explain the medication. The other way how it can present is it can present in the way that you are in the GP clinic and you have to write a re-prescription or a refill. These two scenarios are different. The approach to both the scenarios are different. However, what is the same is talking about the medication. You have to explain what it is, what does it do, what is the benefit of taking it, and how to take it. Okay, these things are really, really important. The other thing that is very important is explaining side effects of the medication. Now, this medication has relatively fewer side effects in comparison to warfarin. What can be the side effect of this medication? Once again, when you are at the point where you are talking about side effects, make sure to ask your patient. There are some side effects of this medication. I would like to discuss those with you. Is that okay? And they say, yes, doctor, that's okay. Yes, I had that question in mind too. That's a very good thing. Please do maintain two-way conversation at all times. Okay. You signpost that you are going to talk about side effects. Now you will start talking about side effects after you signpost. So what are the side effects? Nosebleeds and tiredness. Some nausea also. Okay. These are the three side effects which can happen with this patient. I would advise keeping side effects in your mind for the purpose of the exam, which are very simple to remember, and the solution for those is also quite simple. Okay, so if this patient experiences nosebleeds which are continuous and they are interrupting their daily activities and it's really bothering them, then they can always go back to the GP or call up the GP and have a chat regarding that. Okay, the other thing is tiredness. So taking Apixaban does cause anemia, so that's why they may have tiredness. If they feel they are more tired than usual, then always do not hesitate to take an appointment with your GP and discuss that. You may experience some nausea when you are on this medication, okay? For that reason, eat a healthy, balanced diet, okay? Try to eat bland food, avoid spicy food. Just give this advice, more than enough. If the nausea is getting worse and you would like to talk about it, definitely always you are open to picking up the phone, calling your GP, having a chat about it, or you can visit your GP and talk about it. Okay, anything that's bothering them, they can talk about it. Always give them that option. Follow up Encouraging the patient to make a phone call, telling them about red flags or side effects is very, very important. Okay. Now, after this, give her leaflets, give her written information regarding this, okay? And about the review. So where do you review? Here or in the GP clinic. So most probably this patient will review with the GP. If there are any concerns, okay, like continuous nosebleeds or tiredness, and this patient needs to be looked out by us in the medicine department, they'll be referred to us, okay? But most probably the next review is with the GP, okay? Now, when I say any questions or concerns, what I mean is, so Miss Claire, I have given you a lot of information. I do understand that. It's quite difficult to remember everything. But would you like me to address any questions that may be in your mind right now? Do you have any concerns regarding what I've told you right now? It's a very good place to demonstrate your interpersonal skills, to demonstrate that you are being empathetic. Even if they have questions or they do not have questions, it doesn't matter, but please make sure that you do say this, okay? Is there anything you would like me to repeat? And yes, of course, I will give you some leaflets so you can read, and I'll also write this information down if you would like me to. Okay. So this is about Apixaban prescription. Um, yes. Now, coming to the part where we need to talk about the dose. Okay. If this patient comes to the GP clinic and you are the junior doctor in the GP clinic, what happens in the GP clinic is you ask this patient a brief history of what happened. Have they finished the dose, the loading dose, and are they here for the maintenance dose? If they are here for the maintenance dose, the history, the P1 part, the P2, P3, everything is the same. Explaining about the medication, everything is the same. In the past 1 week, have you forgotten to take any dose? You can add that question, but you can add that question. It's not wrong. And if she says, no, I have not. I have, remembered very regularly. I've taken my medications regularly on time. Please do praise her if she has taken them regularly. If she tells you, I have forgotten to take my pills, then what you would do is you would give her the advice how to remember to take your medications regularly. Spend some time in doing that. Like I always say, it is not important to finish all of the components that you have, okay, which someone has given you, like me or anybody else. What is important is to spend some time and make sure that they understood what you have conveyed to them. Patient understanding, simulator understanding is very, very important. Yes, I agree. You just have 8 minutes. Okay. Always make sure that you are maintaining a two-way conversation and you are checking understanding regularly. Okay. These two things are very important. If you are going for the exams soon, please remember to incorporate this into your practice. Okay. This will get you really good results, right? Now, if anybody has any questions or you do not understand anything or I went too fast, please let me know. Just type on the chat box. I will repeat once again. Okay. For those of you who are new, this session, the recorded session of this discussion would be up on YouTube. So please do check our channel for that. I'll probably post it by tomorrow. Should be out by tomorrow. Okay. And on my Facebook page, I have some tips and tricks, which you can employ in your practice sessions and also when you go for the exam. Very easy to read and stuff that you can easily recollect or remember. And also, please do support me in any way that you can. Okay, by attending the sessions regularly, even that is a way how you can support me. Okay, so please do attend the session regularly. I do encourage that. Why? Because it's very easy to forget all this stuff, and especially when you have 400 plus scenarios to read, it's really very easy to forget them. So please do attend the sessions regularly. If you can, just give me a contribution to that would really help me because, of course, this takes a lot of time to create and then put it out for you. Okay, I'd be really grateful for that. Now, coming to questions, let's see. My YouTube channel is by the same name, My by the Book. Yes. Any questions? Anything that you would want me to repeat or anything that you want me to answer? You are welcome. Thank you so much. Right. Thank you. Thank you very much. don't have many questions to answer it, but if you do, then yes. Okay. How are you going to prescribe in the ward? Do we need to know lab values? Okay, great. So I have a question here that says, do you need to know about normal ranges of lab values? No, you don't really need to know because every place has different reference ranges of lab values. You don't really need to know. But for the purpose of the exam, the normal range would be given to you if it's supposed to be given. Okay. So there's no need to know that. But for the exam, no need. Of course, if you do start your attachment or you start working, then you would need to know. Okay. How are you going to prescribe in the ward? You mean when the patient is admitted? The same way. See, when you are going to stop heparin and start the patient on apixaban or warfarin, it's the same way. First, you give the loading dose and then the maintenance dose. It's the same thing, except that apixaban is a much more safer medication than warfarin. Okay, so I hope that's all. And I would like to thank everyone who has taken their time and attended this session. I hope that it was useful. I hope it was really helpful. Thank you very much. I will see you next week. And next week, yeah. And then after that, I have to do two, three things now. That is, I have to post the new schedule, and I have to post the new schedule. Then I have a surprise session coming up. I'm very excited about that. I will make the announcement on the group. Please do attend. I'd be really happy if you do attend. It's going to be very useful. I'm very sure about that. Okay. Yeah, I worked really hard on that one, so I'm quite excited about it. I'm sure that you all will benefit from it too. It's something really close to my heart, and I'm pretty sure it will make a difference in your practice also when you incorporate those things. So I will make the announcement about it this week, and the session should be this week as well. Okay, so I'll keep you updated regarding the time and when we are going to do it. Thank you very much. I just hope that my dedication and my sincerity just inspires you to continue reading and learning because, like I said, anything can happen, anything can change. Who knows? You might even get a date for the exam very soon, right? So if you do get that date, I do not want anybody to regret and think, oh my goodness, I should have prepared for this before. So what I do is just a little bit of, effort that you are prepared no matter what the situation is. And if you do get an opportunity to attend the exam soon, then I just don't want you to think that, oh, I'm not much prepared, I should not book it. It's always advisable to finish giving the exam as soon as possible because you never know what opportunity waits you on the other side of the exam. So it's always better to finish as soon as you can. Not trying to pressure you, but definitely trying to tell you that continue to read, continue to learn, no matter which part of the world you're located at. Anything can happen. Believe in miracles, right? Yes, we are on Google Meets from now on. Yep. Yes, right. Okay, guys. So I'll see you next week, and yes, in the midweek too. Okay, see you soon. Take care, everyone, till then. And I hope that the people who have the exam soon, good luck for your exams. For those who have exams in the next month, practice hard. Do incorporate two-way conversation, patient understanding into your practice. Okay, this is the advice for you. All right. Take care. Have a good weekend and see you soon.